earlier in the summer. And, you know, in no other area are we seeing requirements that physicians actually have to say certain things to patients, even if they may not be true. So in one sense, I've just talked a lot about how I think speech is being restricted. That's in one sense. But in another context, we are seeing speech being mandated. I'll give you another example. That actually is not necessarily in compliance with medical ethics and other medical codes, and actually is incorrect, some of the information. Another example, in the area of sex ed, we had, before Governor Walker, a very comprehensive sex ed statute that said if you're going to teach sex ed in high school, it had to be medically accurate, comprehensive, and age appropriate. That was repealed and replaced with a requirement that in sex ed instruction, students be told that abstinence is the only reliable way to prevent pregnancy and disease. Well, what's the problem with that? It's wrong. It's not true. So in some areas, we actually are seeing bills that dictate speech. And some of these laws, this mandatory ultrasound in other states has been struck down as being a violation of the physician's First Amendment rights, which is very interesting. So we're not necessarily seeing the equal application of the First Amendment. It kind of depends on what policy that we're talking about. The other area, and we'll talk a little bit about this, is the elevation of the freedom of religion right and right of conscience to trump other rights. And again, we see this, where do we see this? What area? Mostly in women's reproductive health care. But we had a couple examples. We had Healthcare Conscience Act that passed the Assembly. Not sure what's going to happen in the Senate. But this allowed an employer who had some kind of religious objection to not offer birth control in a health insurance plan. Why are we talking about that? Well, because the Affordable Care Act requires that birth control be offered to women in insurance policies with no copay, which is typically why women pay so much more in out-of-pocket costs. Because birth control, prescription birth control, is not always covered. Well, here in Wisconsin, we have a law that says, guess what, it has to be covered. But that's what they were trying to get around. And so what this bill basically said was any kind of employer who had a religious belief, didn't matter if you were actually a religious employer, so this extended way beyond churches and religious schools, because any employer who had a religious belief doesn't have to provide birth control coverage. And in this area, what we are seeing is that right, that religious freedom argument is being used to trump other rights. Right now, there are 2 cases heading to the U.S. Supreme Court on this very issue. There's been 40 challenges to the Affordable Care Act on this birth control mandate. 40 different for-profit corporations challenging the provision in the Affordable Care Act, arguing that they have a religious right. A nonprofit corporation, the first time in history that the U.S. Supreme Court could rule that a nonprofit corporation has a religious freedom right to basically discriminate and decide what kind of health care their employers are going to get. And who's the lead plaintiff in that case? Hobby Lobby is the lead plaintiff. They believe they have, as a for-profit corporation, a religious right to discriminate. So they are using these constitutional arguments that sometimes you hear more on the left, that they're using these arguments to say, we do not have to comply. We're going to see what happens in the U.S. Supreme Court. Lower courts, for the most part, have said, oh yes, you have to comply. But there's been some lower courts, like the 10th Circuit, which is a very, very conservative circuit, that have said, equated birth control with a grave moral sin. And that is the belief of the employer, well, then they should have the right to religiously exempt themselves from that requirement. So we will see what happens, but it certainly has ramifications for us here I mean, it has federal ramifications, obviously, the Affordable Care Act, everybody has to comply with that, but it also seriously guts our Contraceptive Equity Act here in the state. So another example of the subordination of really patients' rights to this religious freedom argument is another bill before myself, I'm in the Health Committee, on mandating flu shots. So most healthcare entities right now do require their employees to get flu shots. You know, you can argue, I think, the pros and cons of that. I can see kind of both sides. But I do believe that when you're a healthcare provider, there are certain things that are required of you, like a license and certain other things. You have to get a hepatitis B shot and whatnot. It's very interesting. The far right does not like that requirement of a flu shot or a mask. I think that's the other option. You can wear a mask or get a flu shot. And so they are arguing that the religious right of the employee should trump, or sorry, the employee should trump the rights of the patient not to be infected by a healthcare provider who might be sick. And you know, when you think about the hospital, who's in the hospital, my 3-year-old just had pneumonia for 10 days. And I think if he had been infected by the healthcare provider, I would have blown my brains out, actually. I mean, I would have said, really, yet. So that's a little bit less clear, I think. But still, should an employer or should employees say, look, these are my religious rights. I don't care that I'm taking care of sick, vulnerable patients. This is my right. I don't believe in shots. I don't believe in medication. I don't know why you'd be in healthcare if you didn't, but these are some of the arguments that we're seeing. So that's just another example of kind of the preeminence. And then the last one I want to talk about is what Chuck mentioned, and that's the First Amendment rights of corporations. And I kind of alluded to it with this new assertion by private corporations they have a religious freedom right. Obviously, in the campaign world, we now have building case law and more case law every day that establish a right of corporations, a political speech right that equates your ability to give campaign donations with a protected political speech constitutional right. And that's Citizens United. And that's what that case did, is it said corporations have a constitutional First Amendment right to give political donations, and they equated that ability to give a campaign contribution with political speech, which is very interesting considering what the Republicans are trying to do to the right to vote. I mean, at the same time, they're saying corporations have, this political right, this First Amendment right to vote. They are, systematically disenfranchising people and their ability to vote with voter ID laws and these other things like eliminating early voting. I would argue, well, that's the ultimate right, the right to vote, and that's certainly the ultimate right of political speech. It's not the campaign contribution, it's actually the ability to vote is an incredibly, I would say, trumps probably any other argument in that way. But that is the other area that we are seeing. And then I mentioned to you the for-profit corporations. And, this just opens the door. I mean, if a for-profit corporation can say, I have a religious freedom right, I mean, what right don't they have? Don't corporations have then? If they are going to make those arguments that they have, rights under the Bill of Rights and the Constitution, just like individuals have. So I think we have to watch very closely what's happening with these things because they really have ramifications for individuals and individual rights. So with that, I wanted to just briefly mention some things that I'm working on that hope to reestablish some of these rights. The first is, and this hopefully is coming soon, is the restoration of the ability to collective bargain. So that bill is going to be coming soon. Obviously, in this environment, is it going to pass? No. But do we need to talk about why it's so important to give workers a voice at the table, which is what collective bargaining is? It's giving workers a voice at the table. Yes, we still need to talk about that and why that's important for all workers, not just public sector workers. That's important for all workers. So I'm working on that. I also did a Citizens United advisory referendum, which basically said, let the people vote on whether they believe that corporations should have a right to political speech, and whether that is equated with making a campaign contribution. So what I would like to see is people of the state have an opportunity to weigh in on that question. So in an advisory referendum, that question actually would go on the ballot next November, and everyone could get it right. Everyone have a voice, an opportunity to express their opinion on Citizens United. And I know Citizens United would go down in flames. You know, it doesn't mean the legislature has to do anything about it, because we don't have a referendum like that in the state. But this is a way for the people to have an opportunity to express their opinion on the issue. So I'm working on that. And I've done a lot of work to reform campaign finance. You know, one big area I think we're still seeing is these issue ads that are not, you know, the groups don't have to register. They say they're not for political purposes, they're not for elections. Certainly they are. They come out right before elections. They're by groups you've never heard of before. And they're all about why candidates should be elected. So that, I continue to believe, is campaign finance, I think, is so important still, to make sure that people have a voice, that people have, citizens actually have the voice in an election. You know, the last presidential election, 32 billionaires gave as much as 3.7 million small donors to Barack Obama and Mitt Romney. 32 billionaires. Now, whose voice do you think is having a greater impact? And I'll tell you, nothing was clear to me that I was at ALEC, whose voice we're hearing above anybody else. And that's big for-profit corporations who are dictating a lot of these policies that we're seeing. A lot of the anti-worker sentiment, it's coming from ALEC. I mean, they've been working on this for 40 years. And this is all an attempt to maximize corporate profit, and it really is about corporate profit in every issue area, from privatizing public education. Why is that such an issue? Well, because people want to make a buck educating children. To gun legislation that we've seen. So in so many different areas, you can see the workings of ALEC, and you certainly see it here in our state. So we have to be very, very vigilant, even when, I hate talking about bad news. The good news is that I think the power of the people still outweighs the power of these corporations. When people understand where some of these policies are coming from, and that's why ALEC wants to be secret. They actually love the First Amendment if, it's making a public university disclose, grade inflation. They're obsessed with grade inflation. They're convinced this is happening in public universities. But when that spotlight is shown on ALEC, they don't like people looking at what they're doing. So we have to continue to make sure we are watching and being vigilant. But I'll leave you with this last story, and then I'd love to have a discussion. When I was at ALEC, they are really obsessed with amending the federal constitution. This is their new effort. You're going to hear a lot about this, about an effort to call a constitutional convention under Article 5 of the federal constitution that states, three-quarters of states, 34 states, will need to pass a resolution calling a constitutional convention to amend the federal constitution. Okay, so this is what ALEC wants to do. They want to amend the federal constitution to limit the power of the federal government in very limited ways to, military, kind of their three core things, just very, very limited. And I sat next to a guy when we were going off to a reception who was talking to me about, wouldn't it be great if we could get a constitutional amendment saying that any federal regulation had to be approved by Congress, which means we would have no regulations, right? We'd have no regulations, or you can kind of see. And I said, no, I actually don't think that would be so great, because, I don't think most people really, that's not very motivating for most people. It's kind of dry, it's blah, blah, blah. So I said, no, I don't think it's very great. And I said, I don't think people would really go for that. He said, well, we have 25 state legislatures and governorships are controlled by Republicans. So we have, we don't have everybody we need, but we're real close to have the number we would need to call for this constitutional amendment. And we have all the money that we need, because we have the corporations. So we don't really need the people. So that's where I think, ultimately, that we win. We win these struggles because most of these policies, whether they be limiting the ability to come to the Capitol to speak or limiting your right to vote, don't help most people. They hurt most people. They don't help you. They don't help, it's very hard to find the people they help unless you're a big corporation or super rich. Maybe they help you. So we still have that, and it's really kind of figuring out how you grab hold of that and motivate people so people don't lose hope, even when these times are very hard. And we're in hard political times. If you're progressive, it is a hard political time. But I would, with all this bad news I just gave you, it still is so important to be vigilant and to be more vigilant than you've ever been to make sure you are watching and holding your elected representatives accountable for what they do. So with that, I'm happy to answer any questions about any topic and have a discussion because I'm really interested to